What is the chemical name of aspirin? Acetic salicylic acid. Option B, acetyl salicylic acid. Option C, acetone salicylic acid. And the fourth option, amide salicylic acid. So, chemical name of aspirin. It is also called as ASA, and here in the options we see all starts with ASA only, but this is a tricky question. So the right answer here is acetyl salicylic acid. This is a medication used for pain, fever and inflammation, and in case of heart attack also we administer this medication to decrease the risk of the heart attack and death. Next question is, what is gout? A, degenerative disorder. Option B, vascular disorder. Option C, renal disorder. And option D is metabolic disorder. The right option here is gout. It is a defective metabolism of uric acid. That means due to formation of the uric acid crystals in the joint, we call the condition as a gout. Okay, and it is a defective metabolism. That means it is a metabolic disorder. Gout, it is a metabolic disorder of uric acid. As I said, in the formation of uric acid crystals, this gets accumulated in the joints and it forms the crystals in the joints, especially the great toe. The joint of great toe is mostly affected in the condition of the gout, so as seen in the picture. So answer is, it is a metabolic disorder. Next question here is, identify the part of human stomach which connects the esophagus. Option A, fundus. B, body. C, pylorus. And option D, cardia. So here in the picture we can see the picture of the stomach. Okay, so this is the cardia, which is the upper part of the stomach, and this is the fundus. Look here, and this portion from the fundus till the end of the pylorus, it is called the body. Okay, so this is the pylorus. This is the pyloric sphincter which connects the stomach to the duodenum, and from the esophagus which connects the stomach, it is called cardiac sphincter. So here the right option is cardiac sphincter or cardia. The right option here is D, cardia. Next question, which one of the following vaccination is necessary for the pregnant lady? Option A, BCG, tetanus, rubella and DPT. So what do you think, guys? The option B is the right answer. Tetanus is a vaccination important for the pregnant ladies. And fifth question, the light of which color is used to treat neonatal jaundice? Red, blue, yellow and orange. So I hope you all have seen the neonatal jaundice condition in the hospitals. So here the right option will be blue light. Firstly, let's talk about the condition of neonatal jaundice. It is a yellowish discoloration of the white part of the eyes and skin in the newborn baby. It is occurred due to the high bilirubin levels in the body. It is yellowish discoloration. Okay, and it is caused due to high bilirubin levels in the body of the newborn baby. Babies with neonatal jaundice may be treated with colored light called phototherapy. So here the light which is used for the baby, and this treatment is called as phototherapy. And in phototherapy, a particular light called blue colored light, it is used for the treatment of jaundice. In the condition neonatal jaundice, we are very aware that the bilirubin levels are increased, and I am going to explain this bilirubin, conjugated and unconjugated level bilirubin in my next video. So please do watch about that video. And coming to this part, this phototherapy's blue light converts the unconjugated bilirubin, which is poisonous bilirubin, into non-toxic bilirubin, and this conjugated bilirubin will be excreted from the stool and the urine easily. So that is the purpose of the phototherapy light. And this phototherapy light was first discovered accidentally at Rochford hospitals in England. This is also an important question. So please do watch my next video regarding the conjugated and unconjugated bilirubin. So here the right option will be blue colored light. And the next question, which one of the following is infectious hepatitis? Hepatitis A, hepatitis B, hepatitis C, and hepatitis D. The right option is hepatitis A. Hepatitis is nothing but the inflammation of hepatic cells. Hepatic cells are liver cells. Next question, internationally, Nursing Day is celebrated on. It is nothing but International Nurses Day. It is celebrated on which day? It is on the May 12th. On the occasion of Florence Nightingale's birth anniversary, we celebrate the Nurses Day. Next question is, the first stool of neonate is called as A. Sebum, B. Lanigo, C. Meconium, and D. Vernix gaseosa. The right option is Meconium. And sebum is an oily secretion of sebaceous gland, and lanigo, it is a hair which covers the body of newborns. And coming to Vernix gaseosa, it is a cheesy or waxy substance, white in color, which is present on the surface of the human babies. Normal newborn human babies, we observe this Vernix gaseosa. So the right option here is Meconium. It is the first stool of the neonate, and usually it is green in color, green or dark black in color. Next question, which one of the following is known as poor man's meat? Option A, milk, B, fish, C, pulses, and D, chicken. The answer here is pulses. Pulses are called as a poor man's meat because they are very rich in nutrition and also low in cost. The cost of the pulses is less than meat, and also the amount of protein which is getting from the pulses are also equal or more than the meat we get. So it is called as poor man's meat. And the next question is, which of the following test is used to detect typhoid bacillus? Vidal, VADRL, BCG, and UDRL. The right option here is Vidal. And the important point here is Vidal test, it is developed in 1896, and it is named after its inventor Georges Fernand Vidal. Typhoid, it is a bacterial infection caused by a bacteria called Salmonella typhi, and the infection is spread from one person to other through the contaminated food and water, and the symptoms will be like high fever, diarrhea, vomiting. And typhoid, it is also called as enteric fever.